All right, it's House Calls, and we're partnering with MedStar Health today to answer your questions about colon cancer. We're taking your calls at 410-671-0702. Dr. Lawrence Mills, a gastroenterologist at MedStar Health, Good Samaritan Hospital, joining us now. Talk to us about what are the risk factors of colon cancer?
Well, there are multiple risk factors. Age is one. Now we're starting to screen people at age 45. It had been 50. But the older you are, the higher the risk of colon cancer. Family history is crucial in terms of colon cancer. In fact, there's some genetic mutations that can cause things like familial polyposis or there's several different hereditary, Lynch syndrome is what I was trying to think of. But anyway, these are hereditary where there's a high incidence of colon cancer in families.
And so how do you diagnose colon cancer?
Well, a colonoscopy is the best way of diagnosing it. But there are screening tests that people do, such as the old-time Hemoccult test. Now we're doing what are called a FIT test, fecal immunochemical test. If people don't want a colonoscopy, they can do a Cologuard test, which is a stool DNA, where you take one stool sample and send it away, and it gives you a pretty good idea of whether you might have colon cancer or you might have polyps. If that's negative, then you can wait and repeat it a couple of years later if you don't want to go through colonoscopy. The last thing you could do is CAT colonoscopy or CAT colonography or virtual colonoscopy, which is a CAT scan where you have to still do a bowel prep and they inject air into the colon and take pictures.
Have they made the prep any better than what it used to be? I've always heard that that's the reason why people don't want to get the colonoscopies, because of the prepped.
Any of the preps are certainly not a picnic, not a walk in the park. The colonoscopy itself isn't difficult for the patient because the patient's asleep. But the prep, none of the preps are easy the day before. You have to be on a clear liquid diet for 24 hours, and the preps are not easy. But colonoscopy itself, you're asleep, no pain. It's not difficult for the patient.
All right.
On the day of the procedure.
Okay, just know that going into it. Dr. Mills, thank you so much. Again, our experts are standing by in Studio B to take your call. The number is 410-671-0702. Get your questions about colon cancer and screenings answered. And they're going to be here until 6:30 taking your calls. Mallory, I'm going to send it over to you now for the next story.